Another day, another story. Tokyo, Japan has seen cases of Streptococcal Toxic Shock Syndrome, STSS, surpass 1,000 in 2024, the National Institute of Infectious Diseases, NIID, reported on June 18th. As at June 9th, the preliminary number of cases in the country since the beginning of this year reached 1,019. Data from the NIID showed, marking a significant increase in the spread of this severe bacterial infection compared to previous years. STSS, also known as severe invasive streptococcal infection, is a sudden onset disease primarily caused by Group A Streptococcus. Welcome to Tabo Eminent Channel. Initial symptoms typically include sore throat, fever, loss of appetite, diarrhea, vomiting, and other gastrointestinal issues, as well as septic symptoms like low blood pressure. If not treated promptly, it can lead to soft tissue damage, respiratory failure, liver failure, kidney failure, and multi-organ failure, with a mortality rate exceeding 30%. The spread of the disease or flesh-eating bacteria infection due to its severity has been notably faster this year. By June 2nd, a record total of 977 cases had already been reported, surpassing the entire count of 941 cases for the whole of last year. The weekly report on infectious disease trends from the NIID, covering the period from June 3rd to 9th, indicated that Tokyo has the highest number of confirmed cases this year with 150, followed by prefectures of Aichi and Saitama with 69 and 68 cases respectively. Japan is experiencing a significant increase in cases of flesh-eating bacterial infections, specifically Streptococcal Toxic Shock Syndrome, STSS. In 2023, the country recorded 941 cases, which was already a record. This year, the trend appears to be worsening, with 556 cases reported in just the first 3 months. STSS is a severe bacterial infection caused primarily by Streptococcus pyogenes. The disease often begins with flu-like symptoms such as fever, chills, and muscle pain, and can progress rapidly to more severe conditions like delirium and extensive tissue damage. Immediate medical attention is crucial for anyone exhibiting symptoms such as high fever and rapid swelling of wounds. Despite the spike in infections, the Japanese Health Ministry has reassured that it is still safe to travel to Japan, advising basic preventive measures like good hand hygiene and wearing masks as necessary. The World Health Organization, WHO, has not recommended any travel restrictions due to these infections. Authorities are urging the public to stay vigilant and seek prompt medical care if they experience symptoms associated with STSS. The situation remains under close monitoring by health officials to manage and mitigate the spread of this dangerous infection. Japan is currently experiencing a significant surge in cases of Streptococcal Toxic Shock Syndrome, STSS, a severe and potentially deadly bacterial infection caused by Group A Streptococcus, GAS bacteria. As of June 2, 2024, the country has reported 977 cases of STSS, surpassing the previous year's record of 941 cases. If the trend continues, experts fear the number of cases could reach up to 2,500 by the end of the year. STSS is characterized by rapid onset of symptoms such as fever, chills, nausea, muscle pain, and swelling. These symptoms can quickly escalate to low blood pressure, multiple organ failure, and necrosis, tissue death. The condition has a high mortality rate, exceeding 30%, particularly among older adults. The increase in STSS cases has been partly attributed to the relaxation of COVID-19 restrictions, which has led to a higher exposure to the bacteria. The elderly are particularly vulnerable, and public health experts are emphasizing the importance of good hygiene practices, including frequent hand washing and proper wound care to prevent infection. The Japanese Health Ministry has reassured travelers that it is still safe to visit Japan, advising them to follow basic infection prevention measures, such as wearing masks and maintaining good hand hygiene. Despite the alarming rise in cases, effective treatments are available, including antibiotics and supportive therapies, which can significantly improve outcomes if administered promptly. Overview of STS. Streptococcal Toxic Shock Syndrome, STSS, is a severe bacterial infection caused by Group A Streptococcus GAS bacteria. While GAS commonly causes mild illnesses such as sore throats or skin infections, it can occasionally lead to more severe conditions like STSS. The disease progresses rapidly, with symptoms including fever, chills, muscle pain, nausea, low blood pressure, and organ failure. It has a high mortality rate, especially in older adults and those with compromised immune systems. Current situation in Japan. Record cases. Japan has reported 977 STSS cases as of early June 2024, surpassing the previous year's record of 941 cases. The trend suggests that the number of cases could reach up to 2,500 by the end of the year if the current rate continues. Mortality rate. STSS has a mortality rate of over 30%, with most deaths occurring within 48 hours of symptom onset. Prompt medical treatment is crucial for survival. Affected demographics. The elderly are particularly susceptible to STSS, though it can affect individuals of all ages. Those with weakened immune systems or chronic health conditions are at higher risk. Contributing factors. Post-pandemic effects. The relaxation of COVID-19 restrictions has contributed to the rise in STSS cases. During the pandemic, public health measures like mask wearing and hand hygiene helped reduce the spread of many infectious diseases, including those caused by gas bacteria. With these measures no longer in place, there has been an increase in bacterial infections. Public health response. The Japanese Health Ministry has emphasized that it is safe to travel to Japan, provided basic infection prevention measures are followed. The ministry advises maintaining good hand hygiene, wearing masks, and seeking prompt medical attention for any suspicious symptoms. Symptoms and treatment. Symptoms. Initial symptoms include fever, chills, nausea, and muscle pain progressing to confusion, low blood pressure, and multi-organ failure. The infection can cause rapid swelling and necrosis of tissues. Treatment. Treatment involves antibiotics, intravenous fluids, oxygen, and sometimes cardiac support. Quick medical intervention is essential to improve survival rates. Even with treatment, recovery can take several weeks. Public health recommendations. Preventive measures. Individuals are encouraged to practice good hand hygiene, keep wounds clean and covered, and follow respiratory etiquette to reduce the risk of infection. Public health authorities continue to monitor the situation and provide updates as necessary. Research and future directions. Ongoing research. Researchers are working on developing a vaccine against gas bacteria, which could potentially protect against both mild and severe infections, including STSS. Continued monitoring and research are crucial to understanding and combating the spread of these infections. Community and individual actions. Vigilance and hygiene. Individuals are advised to maintain good hygiene practices, including regular hand washing, using sanitizers, and keeping wounds clean and covered. These simple measures can significantly reduce the risk of infection. Moving forward, the ongoing STSS outbreak in Japan highlights the need for continued vigilance, robust public health measures, and accelerated research efforts to address severe bacterial infections. The lessons learned and actions taken now will shape the future response to similar public health challenges. By staying informed and proactive, both at the individual and community levels, the impact of such infections can be mitigated, ensuring better health outcomes and preparedness for future outbreaks. Thanks for watching. Request you to subscribe the channel.